Centricity Electronic Medical Record from GE Healthcare is a proven ambulatory system relied on by more than 30,000 clinicians nationwide. With more than 20 years of successful implementations in settings ranging from solo practitioners to some of the nation's largest healthcare organizations, Centricity EMR is an established solution backed by GE's world-class service and support team. When Dr. Winston logs into the electronic medical record, he is able to see information that helps him manage his day. The home page of his desktop is broken down into 3 windows. His schedule on the left, which gives him quick and easy access to patient information. His upper window is internal messaging or information that flows seamlessly within the office. And the bottom window is his task list, items that are pending that he needs to act on. The schedule is an up-to-date view of the scheduling component with instant access to additional information by just hovering over the appointment. This lets Dr. Winston see additional information from appointment type to appointment notes without needing to drill into additional information. The schedule also grants the physician access to the patient record, making it possible for the physician to quickly review the patient's medical information. The flag section is a robust messaging tool for the provider to communicate with his clinical staff. Internal communication flows easily between users, facilitating workflow processes. Dr. Winston reviews a message from his nurse who ran a population report to identify patients who had an elevated LDL and who are not taking a statin. Dr. Winston can quickly respond to his nurse, asking her to set up an appointment for Mr. Clune to discuss the management of his hyperlipidemia. By using a macro, he indicates that he'd like his nurse to follow up and schedule an appointment for lipid management. A patient's electronic medical record would not be complete without information from other care providers. Whether the documentation or information comes from the cath lab, emergency department, patient's home, clinic, surgery center, or somewhere in between, Centricity connects entire care cycles. Images and consults are pulled together in one place, creating efficiencies in the process of accessing patient information. Dr. Winston notes that a discharge summary has come in from the local hospital. Reviewing that information, he sees that Mrs. Rehnquist has recently been discharged from the hospital following an acute exacerbation of COPD. He'd like his nurse to follow up with this patient. He sends her a message to please contact Mrs. Rehnquist and ask her how she's doing following her recent hospital stay. This message is, along with the document or the discharge summary, is going to go on to his nurse's desktop for her to review. And Dr. Winston is able to navigate back to his desktop to continue management of the other tasks that he has to review. He has received a radiology report for Robert Garcia. Dr. Winston can take a look at Robert Garcia's X-ray and also access external devices such as the PACS system, which helps bring information right into his fingertips. This streamlines his workflow by granting him access to important information for diagnostic purposes. Simply selecting the Attach button, it's going to navigate to the hospital's PACS server, so he can review that X-ray film for Robert Garcia. This information helps Dr. Winston see external information that he may need for his patient's care. Dr. Winston navigates back to his desktop to review his schedule. Dr. Winston observes that Donald Cabbage is coming into the office for a follow-up of congestive heart failure. Dr. Winston very simply accesses the chart and reviews a summary page which contains important information that he may need to evaluate and manage Mr. Cabbage's care. He can see a list of his active problems, medications, and allergies. Additionally, he notes that there is potential drug interactions between the medications that he's currently taking. He can drill down further to see the level of severity and even access the note for more detailed information. He also sees that Mr. Cabbage has an acute allergy to oxycodone. The nurse has already roomed the patient, but before Dr. Winston goes in to see Mr. Cabbage, he would like to review additional information. Accessing his problem list, he can see a list of his active problems, or if he needs to see a full problem list history, he can review that too. Mr. Cabbage has a history of congestive heart failure. Detailed information in the lower window allows him to see information from the last time he was seen, and then I can drill down and see additional information. Dr. Winston has similar access with the medication windows. He can see an active medication list or a historical medication list, and even see a full refill history over here on the right. The nurse has already roomed the patient for Dr. Winston, and Dr. Winston is going to review the information that the nurse entered in and update the patient's review of systems and physical exam. Before he does that, he's going to review the patient's past family history and social history. There have been no changes, so he can very quickly document that he's reviewed that and no changes are required. And then using his toolbar, goes into the patient's review of system window to document what might be going on with the patient. Mr. Cabbage has actually entered information last night from the patient portal. Dr. Winston is aware of that and can view the information that Mr. Cabbage entered in and add that to his documentation. Mr. Cabbage's physical exam is relatively normal, with some minor exceptions. He is having some decreased breath sounds on the left, but his heart rate is unchanged and is normal. He notes that he has a small lesion on the back of his left hand, so Dr. Winston very quickly documents that finding and then goes into his assessment and plan. When Dr. Winston is ready to manage this patient, he can use this form as his assessment and plan dashboard. It makes it possible for him to manage this patient problem by problem. He saw Mr. Cabbage today for congestive heart failure, and disease management tools are available, alerting Dr. Winston that this patient is not currently on an ACE or an ARB. He does wish to add this medication to the patient's medication list and puts this patient on captopril. Alerts regarding this medication are visible. It will note potential interactions between his medication list, and Dr. Winston can then make that decision whether he wants to continue adding that medication or change that medication to something else. E-prescribing is also integrated, so the medication is going to automatically be sent electronically to Mr. Cabbage's preferred pharmacy. Mr. Cabbage also had a small scaling lesion on the back of his left hand, and Dr. Winston notes that this is actinic keratosis, and using a macro, documents his procedure note, identifies that this is on the back of his left hand, and adds the diagnosis as well as the billing information. As you can see in the orders section, the billing codes for actinic keratosis is available for billing, and then Dr. Winston can very quickly document that he saw him for CHF and put in his level of visit for billing. Dr. Winston is done with his visit and at this point can sign off on his note. This will automatically submit today's charges into a Centricity revenue cycle management system. The final part of his care today will to print out a consult note, and that's something else that's very easy for him to do. All he needs to do to create a consult note letter from this boilerplate, it will contain additional information from today's note and incorporate it so he can send this back to the patient or to any other care provider who may need this. Dr. Winston is finished today. He can go back to his desktop and manage the rest of his patient's care. By helping you put information at the center of care, Centricity EMR makes it easier to do the things you're already doing and then helps you take patient care to the next level. When you go digital with GE, you can rest assured knowing you've partnered with a capable, financially stable company that shares your vision for healthcare transformation. With Centricity EMR, you're choosing a solution that will support your growth now and well into the future. For more information, visit gehealthcare.com/EMR.